Welcome to the live stream tonight. Sorry for the delay, a little bit of technical difficulties waiting for Joshu TV. That is a channel that we're on, and it wasn't available this evening. But we are here on 4 of the 5 platforms: YouTube Live, Facebook Live, Twitch, and Periscope. And also, if you want to join us via the Discord chat, voice and video, the link is above there, and it is the Biohacker PT hashtag 7376 if you want to join in video or audio. All right. So today's broadcast will be in regards to another chemical. All right. Now we wanted to go ahead and look at why we're here and what is our philosophy here on this channel. Now, you might be wondering, what am I doing on Twitch? Well, actually Twitch has a really good platform. It immediately puts up the information or the video stream online. I commend Amazon for its quick delivery of that. Now the other ones like YouTube, now because I don't have subscribers at this moment, but we'll be getting that soon as we promote the channel in further effort later. It's slow. It takes about a day and a half sometimes to get that back online after it is streamed live. So I'm not sure why, but I'm sure if there are bigger and better channels with ad revenue coming in for them, they'll put that on the top of the list, if you know what I mean. Now, we're here in a season. Just updating here, we changed it a while ago. We were quickly changed now on the talk show portion for Twitch. So join us on the chat. Chat is on multiple streams, and hopefully you can hear me okay. If not, please indicate that in the comments. All right. Now the moderation is not there other than myself looking now and then, so please be respectful of that. Family friendly is always the best, especially in this day and age. All right, so let's look and see what we can find on the document screen here. All right. You can always switch over to my web page, the Biohacker PT, physical therapy hacks for natural healing. All right, I don't see that on the screen. Let's quickly add that if we can. Screen 10 transition. Here we go. There it is. All right. Now, if you're interested on when we are going on live under this live stream notification, you will be able to look at that in the future. All right. And this is my story as well. And I should share that online sometime, but maybe not today. We have a topic on hand. All right, so let's look at the pain connection. PT Biohacks, or PT Hacks for short. And what are we hacking into? Better health, of course. Now, you might think, well, biohacking is quite self-centered. I want to live longer, stronger, and more vibrant. Well, let's think about it as biohacktivism as well, being able to reach out to others with our health and promote their health as well, just like this channel is doing at this moment. So, what is my approach? And what can be your approach, either as a physical therapist or for those who are just listening in and have other professions? What other things can you think about? Well, let's think about the structural approach. Now, a lot of times you go to the therapist and they say, hey, this is the problem. It's your anatomy. It is on the poster. It says, okay, this is the problem. Well, in my dealing with chronic pain, we have to deal with myofascia. Myofascia is, let's see here, I think I might have turned down the volume here. Let me just check it real quick. All right, I think we're okay. Okay, so the myofascial biotensegrity, the neurodynamics, we might talk about that in further details, but right now we're dealing more with a functional approach, dealing with the biochemistry and neurophysiology. The last time we talked about serotonin and how that affects inflammation and immunity and how it is involved with the treatment of pain. I was wondering, well, how do you treat pain? Treatment of pain is a symptom. It's not the source. It's not the cause. Treatment means I'm treating something, and that needs to be something that is tangible, something that is an etiology, something that is a diagnosis. I struggled with that for a moment, and then I thought, well, the treatment of pain. So what is pain treatment? And how is that different than the treatment of pain? It's kind of a play on words, isn't it? I mean, treatment of pain versus pain treatment. Well, I come to have pain treatment. And a lot of times I deal with patients in the clinic, and they come in and they say, I have a problem with such and such body part, and be it shoulder, be it knee, be it back, be it neck, be it their thumb, or be it their big toe, or whatever, and they come in and say, okay, this is the body part that I have a problem with. Now, I'm thinking of range of motion measurements. I'm thinking of, let's see here, strength measurements. I'm thinking of functional improvements. And then, by the way, maybe we'll be able to treat pain on the way. And sometimes as we deal with trying to increase the bend or trying to improve the strength with more repetitions or more resistance, we then defeat the purpose because they end up being more sore. In fact, I worked in a clinic, was attached to a fitness center, and that fitness center had a big window, and it wasn't really a fitness center. It was called a athletic club, and they had beer on tap. So they would be watching my patients leave. They would see them come in, and they would see them leave. And people would comment, well, I'm not going to send my loved one or myself, I'm not going to go into that clinic, because every time they leave, they're limping worse than they are when they come in. I had one individual, a patient, he said, well, if I don't feel good, by the time I reach my car, and I'm going to put my car further away just to have exercise coming in, and also to test if I walk away from your clinic and I feel worse than I do when I did leaving or when I came in, I'm going to come back and get some more treatment because he's wanting to treat his pain. All right, he's not treating his symptom, or am I treating his symptom? But that's his concern. So a lot of times we forget that when we're treating people, that we need to treat what he's wanting to have treated. So we're looking at these different things, and this one in specifics is nitric oxide. All right, so what is nitric oxide? So we're going to go ahead and explain that a little bit. Now, we're a little bit on the scientific side when we're here. I have my smock on, and I look like I'm professional, and I have my degree information online there, and where I graduated, and how many years I've had experience and such like that. Very, very professional, right? But when it comes to, if you have pain and you're listening to this and you're wondering, what's the deal? What can I do? What's the main point? You know, you're used to YouTube video, and it will give you the information in 5 minutes or less. In fact, I prefer that. If I'm looking for video, I'm not looking for something that is more than 10 minutes. I'm not going to spend time with that unless it's, you know, watching some sort of political rally, maybe on a person I'm excited about watching. But I'm not going to listen to something that I want to get the information for. I want to just have the information succinct and to the point, and that's the way it is. All right. Now, this is a little different. This is a little bit of a bantering and a discussion, and actually for you to actually put your information down on what you would like to find out or what to know. Now, we're trying to still find the focus on what we're trying to look for, but we need to make sure that we're not, you know, just talking to the wind or just flowing with the wind, all right? So let's look at nitric oxide. Let's see what we can do with that. All right, so let me see. I'm just doing a little sound check just for a moment, make sure I didn't take myself out with my finger on the dial here. Okay, one man show, just like I tell people in the clinic. I say, well, I'm not going to go ahead and get my degree, a doctorate. Why do I get a doctorate if I'm going to still continue to clean? In fact, my doctorate of science in physical therapy, that is spelled capital D, capital S with a small c, and PT at the end. And the small c in the middle of it all is for cleaning. So I am my cleaner. I am the person who's my aide. I'm the person who does that and cleans up after myself. I guess that's my own fault, but in the clinic that I'm at, that's the situation. All right. So maybe I'm used to talking to myself like I'm probably doing at this point, but that's okay. If we do this for a year and nobody still shows up, well, at least I got some information out for some of you who are listening on the tape of the broadcast. Okay, so now we're looking at the role of nitric oxide in the treatment of pain. So let's see if we can make this more of a presentable program for viewing. Take off all this extra stuff on the back. All right. Okay, so I think that might be good enough. We'll make it a little bit bigger. I always go a little bit over. There we go. The role of nitric oxide in the treatment of pain. So we did the pain connection slideshow. We just finished that. We also had the role of nitric oxide in the treatment of pain, nitric oxide research. All right. And then we went to the search engine. Josh, who's search engine? Dealing with inflammation and pain. Let's see if we can make that. Well, that's okay. We won't be adding. Maybe we will do the adding here. And in the meantime, might as well. It looks like what's the same as we look at that. Sorry for the scratchy evening voice, but that's how it is when you work all day and you play around the computer all night. Let's see here. Let's just go ahead and put a little underline for that. Okay, I want to see if we can underline that. The text there, all right? All right, so let's go ahead and continue on and make sure that we are presentable here with our viewing platform. All right, let's just center that a little bit. The pain connection. So we looked at nitric oxide, immunity, and inflammation and how it relates to pain on the 16th, and today's the 19th. So this is not as fresh as I wanted to be, but that's okay. And you can take this page here and we can open it up on a separate screen. And this is Josh Hu, and hopefully that's working, even though the channel is not working right now on their live streaming and video page. So nitric oxide, inflammation, immunity, and pain. So we're looking at this first article Now we can open that up right here, and if we do that, let's just see how that looks. Make sure that is what it is. And then I have a little summary as we move along here on what's going on with this one. Now I think I might have looked at this article already as one of the main articles that we had from the last session. I'll try to see if I could review here. This was in the spring of 2007 in the International Anesthesiology Clinics. And that's the link right there. So let's just read about this. TGF beta 1, which is the growth factor, beta 1 also antagonizes nitric oxide production in macrophages. Just read about macrophages today. It's very important to know about that as one of the lines of immunity and defense. Nitric oxide has been strongly implicated in the final common pathway of neuropathic pain. So, that's an important statement there. It has been strongly implicated in the final common pathway in neuropathic pain. Now, neuropathic pain is dealing with a nerve pain, right? Doesn't necessarily need to have the structural involved. It can be some sort of functional aspect that's involved with this. That is the problem with the pain. It is the peripheral sensitization, right? That is sensitized. It is the alarm systems turned way up high. Okay, the squelch is turned down real low, so you can hear all the noise, and it's taking that all in. It is expected that by its anti-cytokine action, TGF, thank God it's Friday, right? It's not Friday, it's only Monday, beta 1, or agents that induce its activity may be effective therapy for neuropathic pain. Right? In the central nervous system, there are two types of glial cells, microglia and astrocytes, which can be activated by excitatory neurotransmitters released from nearby neurons. These neurotransmitters include EAA, SP, PGEs, adenosine triphosphate, and nitric oxide. So those are the things that involve, including nitric oxide. All right, let's go to the next article. That was kind of like some random statements there, and we will try to put that together as we move. So this is in July of 2012, dealing with the Annals of Neurosciences, neuropathic pain, role of inflammation, immune response, and ion channel activity in central injury mechanisms. All right, so let's look at that article. So I'm taking this information. Further damage is caused to injured and non-injured tissues alike and is often more severe than the damage caused by the primary insult. Mediators of the secondary damage are due to acute increases in protease, nitric oxide, bradykinins, prostaglandins, and tumor necrosis factor alpha, among others. In addition, these extracellular factors influence a number of intracellular changes that further promote the development of neuropathic pain. So, if we looked at all these mediators, and we can look at an image of that, see if we can find that really quick. looking for a picture that's going to give me some information on that and should show all the mediators, the biochemical mediators that we were talking about here. I use this in the clinic at times. Let's just go under images and maybe we will see it here. The bio mediators. Chronic pain. There we go. Here's a good one here. So these are floating around. These can be floating around right there at the tissue level or along the way or in the brain. So this is the tumor necrosis factor alpha, the interleukin 6, the PGE, prostaglandin E2, and the beta 1. These are all pro-inflammatory cytokines as well. All right, so that's an example of that. All right, so it talks about that. All right. Mediators of a secondary damage are due to acute increases in proteases, nitric oxide, bradykinin, prostaglandins, and tumor necrosis factor alpha, among others. In addition, these extracellular factors influence a number of intracellular changes that further promote the development of neuropathic pain. One of the most potent inflammatory mediators is nitric oxide. It induces vasodilation, enhances the production of free radicals, and mediates important cellular activities through the induction of cyclic guanosine monophosphate, CGMP. High levels of nitric oxide, or NO, are also neurotoxic. Because the half-life of NO is quite short, the level of nitric oxide synthase activity is usually the best measurement of nitric oxide induced inflammation. All right, so we're looking at this nitric oxide. Maybe we could have one more view of that too. So let's look at the images on that, and they're showing us different types of things here. I like this one here. It's involved in neurotransmission, apoptosis, cardiovascular hemostasis, immune response, angiogenesis, and cell proliferation. Here's one also. Nitric oxide is a powerful dilator, is playing a significant role in affecting blood circulation and oxygen production. Key ingredients such as L-arginine boosts metabolic nitric oxide production, increasing oxygen supply, optimizing mineral and nutrient development or delivery to muscles. So this is in the vessels, and it releases, and then it circulates, and that's how it can help the body with moving it from that. So in stasis, it stays in the vessels, but in activity, especially with these high intensity type of interval training activities, can increase that and help the circulatory system overall in its release. into the bloodstream, actually. All right. Of the three forms of nitric oxide synthase, endothelial, neuronal, and inducible, inducible nitric oxide synthase is the primary form active during chronic inflammatory process. The primary cytokine responsible for this inducible nitric oxide synthase upregulation are thought to be the TNF alpha and interleukin B1 beta. So we'll keep on seeing that over and over again, as we saw with serotonin and now with nitric oxide. Constitutively, expressed forms of nitric oxide synthase, neuronal and endothelial, play a more significant role in the inflammation response immediately following injury, as they are released by damaged cells. Neutrophils are commonly found in the bloodstream and are resident in the peripheral nervous system. So I was reading also today about neutrophils, macrophages and neutrophils. These are both important in the process of inflammation, and ends up being part of that immunity response. Invading neutrophils will facilitate lesion expansion via necrotic mechanisms, and also through the production of reactive oxygen species, proteases, and nitric oxide. All right, so let's go back to that article just for a moment and see if we are able to plug into, let's see here. You can see as I'm reading this wonderful large article, we come across the data that we want to present to you in a more of a succinct way as best as possible, of course, because we're being able to provide that information for you if we can. Right? So all those are also very important in that article, so that's another one to look at if you're really into that informational dump, more or less. Now, nitric oxide synthase modulates CFA-induced thermal hyperalgesia through cytokine regulation in mice. Poor mouse. But I guess that's science. We base our whole culture on science, and we forget about the sacrificial status of these animals that are out there, of course. Nitric oxide synthase modulates this thermal hyperalgesia through cytokine regulation in mice. All right, so let's look at that. Several lines of evidence indicate a role for nitric oxide as the mediator of inflammation. So it helps to mediate inflammation. Pro-inflammatory cytokine agonists were further able to reduce hyperalgesia, and inflammation models indicated that the activation of pro-inflammatory cytokines is an important step in the generation of inflammatory pain. To limit the deleterious consequences of prolonged action of pro-inflammatory cytokines, their release is followed by the release of anti-inflammatory cytokines, such as these right here. These are the anti-inflammatory cytokines, and that's IL-10 and the other ones that surround that, which inhibit the production and action of pro-inflammatory cytokines and are anti-hyperalgesic. Nitric oxide is generated in significant concentrations at sites of inflammation in multiple hyperalgesic inflammatory mediators, such as cytokines, prostaglandins E2, we talked about that a while ago, or serotonin, we talked about that last time, are also produced. But it's generated in significant concentrations at the site of inflammation. The literature predominantly documents that pro-inflammatory cytokines stimulate the production of nitric oxide, suggesting that cytokines modulate pain by regulating the release of nitric oxide. you see that? Do you see that right there? Cytokines modulate pain. These biochemical mediators that I showed you a while ago, these help in a and they, you know, there's the ones that are pro-inflammatory and the anti-inflammatory, you know, and we just talked about the ones that are the anti-inflammatory, right? The anti-inflammatory cytokines are so it's a homeostasis. It is a balancing act. The literature predominantly documents that pro-inflammatory cytokines stimulate the production of nitric oxide, suggesting that cytokines modulate pain by regulating the release of nitric oxide. So here it says not the anti-inflammatory cytokines, but it's the pro-inflammatory cytokines that stimulate the production of NO, suggesting that the cytokines modulate pain by regulating the release of nitric. So this pro-inflammatory response is the regulation. So, say for instance we are into the process of anti-inflammation to the point where it is not regulating it too much, the immunity is overboard, and then it causes this reaction and increased pain because it's not regulated. That release of nitric oxide is not regulated, and I've talked about that in other broadcasts, how what's the role of, you know, some of these steroidals. You know, the side effect is the decrease in immunity, but it's that immune response that's causing the the autoimmune response in some sense, or the hyperimmunity that's causing the pain, or the for some patients, or the itchiness, or some patients the like the fibromyalgia, or the chronic symptoms, or maybe even the chronic fatigue, or even some of the things that deal with the body attacking itself. It has to be regulated. Both pro and anti-inflammatory cytokines. Hello, Goof Bob. Nitric oxide, all right. Now, if we wanted to just pause for a moment and we want to think about clinically, what can we do? Now, we can do several things. We can do the high-intensity interval training. We can do BFR, if you know what I mean with BFR. Not BFF, but BFR, right? Blood flow restriction. We can use this therapeutically, or those who use it on their own, those people who are trying to do biohacking on their own, they're doing that to try to release that nitric oxide. And it's helpful not only for the cardiovascular system, but also as we have that modulation as we try to decrease pain. All right? So both pro and anti-inflammatory cytokines can be released by local or migrating cells, and their balance modulates pain sensitivity. It's both. It's not just the anti-inflammatory cytokines. It's not the pro-inflammatory cytokines. In summary, several lines of evidence indicate that cytokine regulation is a novel mechanism by which inhibition of nitric oxide synthase modulates this inflammatory thermal hyperalgesia, this increase in the pain for the mouse in its paw. Usually in that situation, you know, they put some sort of chemical on its paw and it's burning, and they want to find out, okay, what's going on with that. Furthermore, our present data and studies from other groups strongly suggest that there might be a feedback loop between nitric oxide and cytokines, which modulates inflammatory pain. So there's this loop, this feedback loop between nitric oxide and cytokines. All right. So that's all I have for today for the article research. I know it's limited, and we will expand on that as we move forward. And it's going to be very important. Now, how can you stimulate nitric oxide in your own body? Well, for one, is to stop breathing through that mask by your mouth. You know, you need to breathe through your nose, because in your nasal passages, there is that effect of the generation of nitric oxide, the release of that as you breathe in through your nose. Now, a lot of time in the clinic, we're counting, letting them count out loud. All right, they're counting 1, 2, 3, and 4, 5, whatever. All right, so you're letting them breathe through their mouth, and in a way that you can help their nitric oxide release is to let them breathe through their nose. 1, 2, they're breathing through their nose. That can help. Another would be a lot of people when they eat, they immediately start chewing gum. All right. Now, sometimes your saliva is involved in the nitric oxide release as well. So it's important now also to have the saliva glands to be able to produce that as well. So we can look at that in further detail in the future. Another one is to do the Zach Bush nitric oxide dump. All right, it doesn't sound exciting to dump, but this dumps that out of the stasis. You're sitting here too long. You could do this like 2 or 3 times a day, and you can do the nitric oxide. And it's an excellent exercise for those in rehab. It really is, because it's very simple. All you have to do is you have to have your squats when you're up and down with your arms 10 times, 20 times, and you're doing it as quickly as you can. I mean, the goal is to do in 7 minutes of time, 2 rounds of high intensity interval training. But in nitric oxide dump, you're just doing it straight on. So you're doing that. The second one is your arms up and down. All right. The third one is your arms up and down with your motion. Very simple. You could do it right now if you wanted to do it with me. And then the fourth would be yeah. Okay? Now, again, breathing through your nose. Another one that we just learned over the weekend from the biohacking conference is the Weyhoff breathing. Very excellent. 30 times. Deep breathe. Deep breathe. Also the cold splash at the end of the shower. Okay, these are all enhancing this effect that can help your patients, or you yourself, or those people who you're around. All right, let's see here. Everybody is working on a nitric oxide inhalant for COVID relief. Yes, and it's going to be very important if you looked at Dr. McCullough and they talk about nitric oxide. Another way to do it is through your diet. Get some fermented beets as a powder if you want to. I'm not promoting products, but you can that will help the dietary aspect. So we tie our hands to say, oh, we can't say anything because, okay, we're not nutritionists, we're not the dietitian, we're not the naturopath. We didn't just take the, even though I have a doctorate of science and physical therapy, you don't want to tread that ground that passes over that way. But how much can it help if we have that eclectic approach with all that? So now it's Novan Inc. is working on a inhalant. Interesting, yes. And that's how we talk about this, the cytokine storm, and how it needs to be controlled. Now, there could be like 2 people. One is like highly inflammatory and a diabetic, and then the other one might be perfectly healthy without that. And then COVID, at least in the early stages, actually in the later stages, there is that the cytokine storm aspect of it. All right. And what happens is that the diabetic, the inflammatory one, will actually do better than sometimes the one that is the healthier, because their hyperimmunity response to the COVID, to the receptors that are on there affecting the ACE2 receptors in your lungs, they attach and they have a kind of like a party, not a party, but it's a suicide party basically, because it just destroys the lung and it obliterates it. You end up having the secondaries issues. Of course, the person who's the more susceptible at the early stages is probably the person who has the blood sugar issues. But then later on, these people are better, and then that's how children are involved with that as well. Okay, so I'm not going to delve too much in that, because we're on YouTube and we have to have the correct data for them to make sure that we're not flagged as some sort of creating some sort of panic or misinformation or anything. So we definitely want to not say that. You have to continue to do your own research with that and make sure that you know what you're talking about when you are either a medical professional or those who are just spreading your own news as you spread it around to other people, of course. All right, so we're going to end in a kind of a quick way today, but we will be coming back on Wednesday for the second half. Now, we're going to probably go over this again, and we're going to just make it more palatable, I guess, for you to understand, and then maybe we can go through some demonstrations of how to include that on your own to get this nitric oxide for the balance of your of this to help modulate your sensitivity for pain, especially those who have neuropathic pain. Thank you for joining for this broadcast. Please subscribe to the channel if you're on YouTube or on any other channel, and please see if you can make some good comments on there if you'd like to. I appreciate that, and we wish you the best of health and safety. Thank you so much for joining me tonight, and hopefully we can build this channel and the information that we can provide. Thank you, Goof Bob, or Goof Boob. I like that. All right. So we wanted to go ahead and think about how the body is made. And we have to gain an appreciation of this. And we not only have to rely on science all the time, because there is only a limitation that science has. We have to sometimes go with our gut, if you know what I mean. That gut has a tremendous amount of ability to guide us. Maybe not in a conscious way, but we might be able to gain more knowledge by going with what we know and adding on that with science. Now, who has the narrative? Those pharmaceutical companies? The people who are in power? The people who have the money? All right, we're not here to talk about politics. We're here to talk about our lives. I mean, can you be concerned overly over a certain topic or a certain movement? Yes, you can, because you're not affected by it, but you're standing up for that. You're doing what you believe in. But what we do and what we see and what we hear, what we want to promote is health and longevity. And we can gain that. Now, if you gained that knowledge from my last one, dealing with more of a spiritual approach, that spiritual connection, we can see that it is the ultimate hack, that ultimate biohack, is to plug in to some sort of spiritual connection, either be it a support group, be it your belief in the divine, to be in your own tribe, could be any of those. But grab a hold of it, and that can be your lifeline for you and those around you. Please do that and rely on that as well. And you will find better health, better immunity, better control of your inflammation and even your pain. Thanks again.